Hello everyone, welcome to another episode of Wild Child Wellness, where we discuss natural remedies for common childhood symptoms and when to seek medical attention. Today we are talking about allergies and just want to take care of a couple of points of business first. So I'm Julie DeVono. I have 30 years experience in pediatric medicine, including an extensive amount of experience with medical herbalism for children and homeopathy, as well as mainstream medicine, so I can give you guidance on when you may need to seek medical attention. First things first, this video is for information purposes only and is not a substitute for medical advice from a qualified, trusted medical provider. So, like you've heard me say before, you want to get yourself one of those. And just to let you all know what I've been up to or what I have going on, I'm just going to give you some information about some upcoming events. This Saturday, March 23rd, I will be at Crystal Garden Salt Cave in Mount Pocono, Pennsylvania, to just participate in their wellness fair. And Friday, March 29th, I will be in New York at Charmed Eclectic Healing for a 7 o'clock class on colloidal silver, where we'll delve into different various ways you can use that product to substitute maybe some other mainstream commercial medications or products, to substitute it with something a little bit cleaner and a little bit healthier and something more natural. So, and also if you want more information than I'm going to provide in today's video, you can get a more in-depth, longer video on my Patreon page, where I'm going to discuss natural remedies for more specific allergy symptoms in greater depth. And that's on my Patreon. I will put the link in this video for that. If you appreciate these videos, you can show some support with a small monthly subscription to my Patreon page, or you can give me a tip on the Buy Me a Coffee app, which is, I'll also put a link in the video. Or you can buy a copy of my book that's available on Amazon, or you can check out my website if you want to schedule a personal consult. So, get that all out of the way. Today we're going to talk about natural remedies for allergies. So let's start with, I'd like to start with a basic explanation of how allergies happen. So allergies are what's called an autoimmune condition. There are different kinds of autoimmune conditions like eczema, rheumatoid arthritis, asthma, and basically all of these conditions occur when the immune system gets confused and attacks yourself. As opposed, it confuses your own body with being some kind of foreign danger, and it activates all of those defenses inappropriately. So this means it happens when the immune system triggers the body to produce histamines, which are the body's weapons to protect itself, but instead it's turning those weapons on the wrong thing. It's turning it on yourself. And histamine is the chemical that you'll hear me refer to frequently, because that's the actual weapon. When the histamine is created by the body, that leads to these other symptoms, whether it's rheumatoid arthritis symptoms or asthma or eczema, even things like Hashimoto's. And I know I'm going a little bit off course there, but those are all just different examples of autoimmune conditions. And autoimmune conditions can be a result of a hyperclean or sterile environment. What I often say is that the immune system is like a toddler. If it's not kept busy, it's going to get into trouble. And we see that globally when we look at what kind of health problems affect different parts of the world. And in countries where they have a lot of infectious disease, they have a very low rate of autoimmune conditions because their immune systems are too busy fighting infectious diseases like cholera or dysentery. And then in countries like the United States, where we have infectious disease for the most part under control, we have a much higher rate of autoimmune conditions. Our immune systems are bored, they're not being kept busy, so they turn on ourselves. So it's interesting when you see that disparity globally. That being said, I'm not taking sides. I certainly wouldn't want to choose dysentery or cholera over asthma or eczema, but like in all things, if we were able to find a balance between having a clean environment but not too clean, then we would have it just perfect. But we haven't accomplished that yet. We, as human beings, we have a tendency to swing to one extreme or the other. So allergy symptoms occur when the body is actually trying to protect itself. It just gets confused on how to do that. So the beginning, it starts with whether or not you're born with what's called the atopic gene. So you may be born, you'll inherit this gene from your genetics of your family, or you won't. So in that way, it's kind of like a lottery. If you are lucky enough to not inherit this gene, then you are unlikely to suffer from these conditions. But the majority of people, especially nowadays through evolution, most of us have that atopic gene, and that atopic gene is the genetic cause of sending those messages when you're facing certain triggers. And I don't mean my cat, his name is Trigger, he just looked at me. But triggers like dust or pollen or mold or, things like that. So your body is exposed to these triggers, and then your gene activates histamine production. The histamine tells the body to do certain things that it thinks are the right thing to do. For example, a runny nose, watery eyes. That's the body trying to wash those triggers, those pollens out before they get into your body and make you feel sick. Things like swelling, like nasal congestion, or even in the bronchioles, like with asthma, where the bronchioles get tight. That's the body trying to block those triggers from getting in. It just does it too much. It kind of overcompensates. So the chest congestion, which is also called bronchial constriction, and things like that. It's all the body's trying to protect the respiratory tract. So how can you maybe prevent these allergies from being developed if you're young, or, if you have a child who, you suspect you may have the atopic gene in your family, but you want to try to do what you can to prevent this from developing into allergies? Well, let your kids get a little dirty, because, that too clean of an environment won't help. And, we know the healthiest kids on the planet are the ones that are raised on farms, playing in the dirt with the pigs and the chickens. But of course, modern living, unless you run a farm, that just means don't reach for the Purell so quickly. Don't reach for the Clorox so quickly. When your kids are outside getting dirty, let them do that. It's really not a bad thing. Of course, you don't want to live in filth, because then you can get sick in other ways. But again, it's finding that balance. And another thing is get a fuzzy pet. Like we have a cat. We actually have 2 cats, or a dog, or like my Easter picture up here, a pet rabbit. Now, of course, if you already know your child has asthma or allergies, then it might be too late, and that may not be a good thing to do, because then you're bringing the trigger into the home. But if you have a perfectly healthy young child and you're trying to decide whether or not to get a pet, know that there has actually been scientific research that have shown that children who grow up in a home with a fuzzy pet, fish and lizards and snakes, they may not do the same thing, but children who grow up in a home with a pet tend to have fewer allergies. Plus, they also have all sorts of other benefits, like social and emotional benefits. So, I'm definitely in the pro-pet category when it comes to that decision. Now that you have reached a point where you already know you do have allergies, what can you do to try to prevent outbreaks? So now we're not talking about preventing the development of allergies. We're talking about, you already know you have allergies. How can you minimize the number of allergy outbreaks that you have? Well, the first step is environmental management. And that may be common sense, but there are some tangible things that you can do that have actually been proven to be advantageous, like replacing carpets with flooring. Why? Carpets can harbor a lot of dust, maybe even some mold, and the maintenance of keeping them clean, it's a lot harder than having a wooden floor or laminate where you can use a Swiffer or a vacuum more frequently, and clean it and keep it from building up those triggers. Replacing curtains with blinds, same concept. Instead of having a cloth curtain that can trap dust and other triggers and other allergens, the blinds are a little bit easier to keep clean. So again, it's like I just got done saying how important it is to not be too clean. Now I'm telling you that you have to clean up. Again, it's balance. Getting an air purifier. I have a son with asthma, and despite any efforts to the contrary, we've always had fuzzy pets. So I've had to be a little more careful about him with his asthma. And one of the single best things I ever did was get an air purifier. I was on the fence about whether it would really make that much of a difference because it was a financial investment. Although we found a perfectly good one at Home Depot or Lowe's for just under $100. And the filters were about $11. They have to be replaced about every 3 months. But I did have to think about it. Well, I'll tell you, we went for it, and it was one of the best things we ever did. Having that air purifier in his bedroom, you could almost feel that the air was cleaner. It almost smelled cleaner. Of course, now he's a teenager, so his room doesn't smell very good. But at that time with the air purifier, you could feel the difference. And what's important about having it in the bedroom is there's been research that shows that if you can't purify your whole house, the quality of the air you breathe while you're sleeping can have a huge impact on the symptoms you have through the rest of the day. And we think that might have something to do with how the immune system is more active while you're sleeping at night. So in order to maximize the effectiveness of your intervention, which is a medical phrase that we like to use, putting that air purifier in the bedroom and having that cleaner air while you're sleeping at night will actually have a bigger impact than maybe having an air purifier in the playroom or somewhere else in the house. So that really made a big difference for us, and the research shows it could make a big difference for anybody. So it's definitely worth looking into. Other things, just trying to keep your respiratory tract cleaner. I had discussed this in a previous episode, a previous video about colds, but just doing something as simple as a saline nose spray every morning helps clean any pollens or any antigens or not antigens, allergens that have built up. You know, our nose is kind of like a filter for the air going into our body. That's why there's hairs in it and it's moist, because those moist hairs are supposed to trap those allergens so they don't get into our respiratory tract and make us sick. So just by cleaning out that filter once or twice a day with some saline spray, which is just salt water, there's no medicine in it, can really make a big difference. So because if those allergens can't get into your respiratory system, they can't make you sick. There's also a product called Clear, but it's spelled with an X. So I don't know if it's pronounced X-Clear or Clear, but that's a saline nose spray that has a little bit of xylitol added, which is a little bit of a sticky substance. Works even better than just plain saline, but it's perfectly safe for babies. It's not a medication. It's just this sticky substance. And I've used it personally because I was afraid, well, is this going to leave a weird taste in my mouth, or is this going to feel weird? And it didn't. So whatever that amount of stickiness that's in this, it's not enough so that you would taste it or feel any different. So I recommend that as well. Now, moving into the next step, is there a way to actually make your body less sensitive? Well, there are, and that's called desensitization. In mainstream medicine, we are maybe more familiar with that process called allergy shots. And what the allergy shots are doing is injecting a tiny bit of what you're actually allergic to. For example, if you're allergic to cats, your allergy shots would have a teeny, teeny, tiny amount of cat fur allergen protein in it. And by injecting it into your bloodstream or into your body, instead of going through the respiratory tract, it's like sneaking through the back door. It's introducing these allergens into your body through a different way, so your body isn't on guard looking for it, kind of sneaks it in. And then with the dose increasing over time, it retrains your immune system to recognize that as not being something dangerous and foreign and something that it can be okay with. Now, there is a natural way to do this. It may not be as quick or as strong, but if your allergies are mildly irritating and you want to try something natural, a lot of people have had a lot of success with using a raw wildflower honey. This is my little wildflower raw honey bear that I get from our local Amish farmers market that we're lucky enough to have here. And if you take 1 or 2 teaspoons of that honey 2 or 3 times a day, and I know that doesn't sound like much, but I've had people tell me it's a lot of honey, but you can add it to tea or add it to oatmeal or other things, and it still works. So some people say, well, what if I put it in something hot? Does it deactivate it? No, it works. And what you're doing is the same concept. You're introducing these pollens because the honey is full of a concentrated amount of these pollens, of these allergens, and you're taking it by mouth and you're eating it, so it's going through a different part of the body than if you're breathing these pollens in. So again, same concept, sneaking it in through a different pathway so your body can get used to it and change its response to it. Now, you do want to get wildflower honey. I know that you can often buy commercially prepared honey that's where the bees are just fed sugar water, and of course that's not going to work. That's why I always recommend the raw honey, because it's also not pasteurized, because the pasteurization process, because it is such a high heat for a certain amount of time, may kill off those pollens. So that's why you want to get the raw wildflower honey. And it may take a couple of weeks, but I've had a lot of people tell me that the beginning of allergy season, they start using it and it works well enough for them so that they can avoid the allergy shots. Now, if that doesn't work, now we're getting into symptom relief. Is there something you can take every day during allergy season to help mitigate the symptoms that you experience? And of course, there is. There's a product, you might have heard me mention Dr. Nenninger a couple of times in previous videos. He's a naturopath that produces his own line of products. And I do not get any kind of kickback or discount or financial benefit from him. I'm truly recommending these products because I have a lot of personal experience with them as well as professional experience, and they really do work well. And I also like them because they're very safe for young children. It's safe for 6 months and up. The dose is 1 drop per every 5 pounds of body weight. So if you have a 20-pound child, you're going to give 4 drops. The adult dose is 20 drops. So do the math. And I talked about his products, his flu preventative during the cold and flu video. He also has one for allergies. It's the one with the green label, and it's for mold, pollen, and dust allergies. So if you have another type of allergy like cat or rabbit, then it may not work as well. Although I looked at the ingredient list, and a lot of the ingredients are more symptom specific, so it may still help, but it's very safe. And the amount that you have to give is so small. That's one of the things I like about these products. It's a little easier to give to children because if their dose is only 3 drops, you could get them to take 3 drops, or you could put it in a teaspoon of water or juice and they could take it that way. Don't put it in too big of an amount of water or juice because then you got to sit there and try to get them to drink the whole thing. But putting it in just a teaspoon down the hatch. I used to put it in a little shot glass with some water. My kid thought it was fun, like down the hatch. Maybe it's the Irish side of him. I don't know. But anyway, that's a good one. And you can take it once a day, or you can take it up to 3 times a day. So those are just some little pieces of advice to help you get through allergy season. Again, if you want to go into a deep dive, my Patreon page, I have a longer video that goes into more natural remedies, homeopathy, and medicinal herbalism for specific targeted allergy symptoms. Because some people only suffer from eye allergies, some people only suffer from runny nose and congestion, some people it's more bronchial. So if you want that information, you can check out my Patreon page and look that video up. And before I end, I want to add a new feature to these videos that I thought would be kind of fun. So I have been, you can always email me or any questions you may have. The email address is wildchildwell@gmail.com, and I'm happy to answer your questions or set up a consult if it's a more involved discussion that's necessary. But I thought it would be fun to share some of these questions and answers with you. I got an email from a parent. Her name is Sandra, and she asked, Why do they tell you to finish all of the antibiotics for 10 days? My child seemed like he was all better after 5 to 7 days. I would prefer not to give too much. Do I really need to continue the full 10-day course? Well, the answer to that, unfortunately, is yes. And that is because we do have a problem with antibiotic resistance. It's shocking to discover that we haven't been able to invent a new antibiotic in like 40 years. For a while there, we were really on a roll. We were discovered antibiotics. We were creating a lot of new antibiotics and some antibiotics that were better for these infections, and things were going great. And then about 30 to 40 years ago, it stalled. We just haven't been able to come up with any new ones. So we have to be really careful with the ones we have. One of the things we discovered over time is that, 30 years ago, doctors might have been like, oh, there's no harm. If you're not sure, just take it. But then we started to learn that we needed to treat antibiotics with more responsibly, because what was happening is if you don't treat the infection completely and there's a small amount of that infection left untreated, well, you just taught that bacteria, that infection, how to recognize that antibiotic. And it's sort of like, if you think of it in military terms, you got attacked, you threw your defenses at it, but in doing that, you also taught the attacker what your defenses are. And then if you don't annihilate all of them, those few that survive can go back and build up a better plan, saying, oh, well, now we know the defenses. We know how to recognize it. We know we can figure out how to overcome it. So then the next time you get the infection, that antibiotic may not work as well. So our solution to this in medicine is to just make sure, excuse me, I'm still trying to figure out how to edit out coughs in videos. Haven't figured that out yet, but I'm learning. So the only way we know how to handle that is to make sure that when you take an antibiotic, you take it for a couple of extra days to ensure that all of the infection has been eradicated. And that's why very commonly you do have to take it for an extra couple of days beyond when you're feeling better. I often recommend when treating pink eye, especially because it's so contagious, and because if only a little bit is left, you could end up starting this vicious cycle all over again. So I always tell parents, after your child seems better, do the treatment for a couple extra days. I often say that with diaper rash. When the diaper rash is better, do the treatment for a couple extra days to make sure it's all gone. So unfortunately, that's what we're stuck with. But that's why I always recommend we treat antibiotics with the respect that we only take them when we're absolutely sure we need them, so that we don't take them unnecessarily. But if you do need to take them, you have to take it for the full course. So now another question that I got, this one's fun. This one's from a child. So Terry emailed me, probably with his mom's help, I imagine. Maybe not. I mean, some kids, my son's better with technology than I am, so maybe not. But Terry asked, why did they make medicine taste gross? Couldn't they make it taste good? Well, I hate to tell you this, the answer is yes, they actually could. They could make medicine taste just as good as a lollipop. You would never even taste any of the medicine part of it. But there's an important reason why we don't. And that is because medicine, it's very important to take the exact right amount. If you take too much medicine, then that medicine can make you sick. So by making medicine taste a little bit yucky, it reminds you when you're taking it that this is medicine and I only should take the amount that is recommended or prescribed. When I was a kid, we used to have something called Flintstones children's vitamins, and they might still be on the market, but those tasted really good. And what happened was, one of the most common reasons for children to come to the emergency room when I worked as a nurse in the ER was because they would get a hold of that bottle of Flintstone vitamins and they would take the whole bottle. Sometimes we see this now with gummy vitamins too. So you have to be careful. So, it's not a law that medicine needs to taste yucky. There are some companies like gummy vitamins that make medicine taste good. And yeah, that makes it easier to get your kid to take it. But then we also see on the other side that we have a much higher number of children who end up in the emergency room for overdose on those products than the products that still have a little bit of a yucky taste to them. So it's a built-in way to keep kids from taking too much. And of course, now we also have child-safe caps. But let me tell you, I mean, look, the joke is with a child-safe cap, the kid is the only one that seems to be able to get into them. So we have to make sure we have these extra safeguards so that if a child does get into a bottle of medication, they tend to only take one or two before they realize, ooh, that tastes gross, and they spit it out. If it's a medicine that tastes good, they take the whole bottle. And, you know, recently in the last 5 years, this is no longer for the kids. This answer is for the parents out there. We've seen situations with the increased use of medical THC gummies to treat anxiety. Well, we've seen a couple calls where, you know, parents have called in a panic because their child ate the entire bag. And that's because, let's be honest, if a child gets into a bag of gummies that tastes really good, they're not going to take just one or two. They're going to eat the whole bag. And that's why I always recommend, even if you need to use things like that for medical purposes, opt for the pill form instead of the gummy form, especially if you have young children or even not so young children, because I'm sure if my teenager found a bag of gummies, he wouldn't question what's in them. He would probably just eat the whole bag also. So a little bit of a just general safety parenting advice there. I know it doesn't have anything to do with allergies, but, you know, I like being able to answer your questions. So that being said, as a reminder, if you want to email me some questions, the email address, wildchildwell@gmail.com. And I look forward to seeing y'all next week with another video. I know this week's video was a day late, unfortunately. I just ended up taking a little too much time with the editing process. I'm still learning, but you know, I'm trying to still get it there. Maybe as I get better at this, I'll get quicker and things will be on time more often. So that's it for today. Remember, it's a beautiful day out there, no matter what kind of day it is. So get out there and enjoy it. And I'll see y'all next time.